Have you ever felt an unexplained sensation in your body, one that made you wonder if it's something serious? Maybe it's a sudden pain, a deep fatigue that doesn't go away, or a breathlessness you can't explain. These sensations might seem small or temporary at first, but the truth is, our bodies often send out warning signals before something life-threatening occurs. The problem is, many of us tend to brush these signs off, thinking they'll go away on their own. But what if ignoring them could cost you your health, or even your life? As we get older, our bodies can experience changes that we may not fully understand, but these changes can also point to something much more serious. Doctors often see patients with these symptoms, and they know that, while they may seem harmless at first, they could be the first indicators that something is terribly wrong. That's why in this video, we're going to talk about 6 warning signs that should never be ignored. From unexplained fatigue that leaves you drained to chest pain that feels like a heavy weight, each of these signs is your body's way of telling you something important. It's crucial to pay attention to these signals, because by recognizing them early and acting quickly, you can take control of your health before it's too late. So stay with us until the end. This information could literally save your life. Let's dive into the 6 warning signs that could mean the end is near and why you shouldn't ignore them. One of the most concerning and often overlooked warning signs is unexplained extreme fatigue. Now, we all know that feeling tired after a long day is normal, but what if that tiredness doesn't go away, no matter how much you sleep? It's the kind of exhaustion that lingers, the kind that doesn't improve with a nap or a cup of coffee. If you find yourself feeling drained and weak even after a full night's rest, this could be a red flag that something is seriously wrong. Take a story of Mary, a 72-year-old woman who had always been active, walking several miles a day and enjoying her time with family. But one day, she noticed that no matter how much she rested, she felt incredibly tired. Simple activities like cooking dinner or even getting out of bed became difficult, and she found herself unable to do the things she once loved. At first, she thought it was just the natural result of aging. However, when her fatigue grew worse and started affecting her daily life, she knew it was time to seek help. After visiting her doctor, she learned that her fatigue was linked to heart failure, a condition where the heart struggles to pump enough blood to meet the body's needs. In fact, extreme fatigue is one of the first warning signs of heart disease, and for Mary, acting early allowed her to start treatment and improve her quality of life. Extreme fatigue that's unexplained or lasts for weeks should never be ignored. Research shows that chronic fatigue is a common symptom in people with heart disease, kidney failure, or even cancer. According to the American Heart Association, fatigue is often one of the first symptoms that heart failure patients experience. In fact, one study found that 73% of heart failure patients reported feeling unusually tired as one of their first signs, even before they noticed shortness of breath or swelling. This fatigue is more than just feeling tired. It's a deeper kind of exhaustion that doesn't let up, making everyday tasks feel like mountains to climb. When this kind of fatigue hits, it's important to pay attention. Ask yourself, when did this start? Has it been getting worse over time? If you used to have a good amount of energy and now feel drained without any apparent reason, it's time to talk to your doctor. The earlier you take action, the better your chances of understanding what's going on and addressing the root cause. Don't wait for it to get worse before seeking help. Fatigue like this is a sign that your body might be using all of its resources just to keep going, and that can mean your organs are struggling to perform at their best. It's not just a sign of aging, it's a signal that you need to listen to. And if you've been feeling increasingly tired without a good explanation, it's crucial to take action and get checked out by a healthcare professional. Remember, ignoring this warning sign could be the difference between early intervention and letting a serious condition go unnoticed until it's too late. So keep an eye on how your body feels, and if you notice unexplained exhaustion, don't dismiss it as just part of getting older. Your health deserves your attention, and acting quickly could save your life. Another sign that should never be ignored is sudden and severe chest pain or pressure. This is one of the most alarming symptoms and can signal something incredibly dangerous. Imagine you're going about your day feeling fine when suddenly you experience an intense, crushing pain in your chest or a heavy, squeezing sensation that feels as though something is weighing down on your chest. It might start out slowly, or it might come on quickly and feel unbearable. You may even feel it radiating into your arm, neck, jaw, or back. You could try to convince yourself it's just heartburn or muscle strain, but let me be clear. This is not something you should take lightly. If you experience chest pain like this, especially if it is severe and persistent, it's time to seek immediate medical attention. Think of James, a 68-year-old man who had a heart attack just 2 months ago. James had been experiencing minor discomfort in his chest for a few days. He brushed it off, thinking it was nothing serious, maybe just some indigestion. One morning, however, the pain became unbearable, and he felt a tightness across his chest that he couldn't shake. He felt dizzy, and cold sweat broke out on his skin. His wife urged him to call for help, but James hesitated. He thought, "I'm probably overreacting. It's probably just a muscle pull or some stress." It wasn't until the pain started spreading to his left arm that he finally made the call. The paramedics arrived just in time to rush him to the hospital. He had a heart attack, and the doctor said that if he hadn't gotten help when he did, he might not have made it. The thing is, heart attacks don't always present with the dramatic, sudden pain we see in movies. Sometimes the symptoms are subtle, just a discomfort in the chest, or a vague feeling of pressure that could be mistaken for something less serious. That's why many people like James ignore the warning signs and wait too long to get help. According to the American Heart Association, every 40 seconds, someone in the U.S. has a heart attack, and 1 in 5 heart attacks is silent, meaning the symptoms are mild or barely noticeable. But even a mild heart attack can still cause permanent damage to the heart, and the longer you wait to seek treatment, the more severe the damage can be. If you feel any kind of pain or pressure in your chest that doesn't feel right, don't wait. Call for help immediately. Every minute counts when it comes to heart attacks. The sooner you get medical attention, the higher your chances of survival and recovery. Ignoring the pain or trying to wait it out can be a fatal mistake. Many people have survived heart attacks because they acted quickly, but many others didn't make it because they dismissed their symptoms or waited too long. So if you ever feel that intense pressure or crushing pain in your chest, do not hesitate. Your body is telling you something critical, and ignoring it could cost you your life. Trust your instincts and don't ignore a symptom that could be a matter of life or death. By getting help immediately, you're giving yourself the best chance to survive and recover, no matter how mild or severe the pain may seem. Please remember, your heart is one of the most important organs in your body, and its health should never be taken for granted. Next, let's talk about another crucial warning sign: difficulty breathing or sudden shortness of breath. Imagine sitting in your favorite chair, feeling relaxed and doing nothing strenuous, but suddenly, out of nowhere, you can't catch your breath. It feels as though the air has become thinner, and no matter how deeply you inhale, it's not enough. You feel like you're suffocating, even though you're doing nothing physically demanding. This isn't just discomfort or the result of getting older. This is a major red flag that something is very wrong. It could be a sign of heart failure, a pulmonary embolism, a blood clot in the lungs, or even a silent heart attack. Let's take a moment to consider Nancy's story. Nancy, a 70-year-old woman, had always been active and healthy. But one afternoon, while sitting on her porch reading a book, she suddenly felt like she couldn't breathe. She gasped for air, her chest felt tight, and it was as though every breath she took wasn't enough. She tried to calm herself, thinking it was just a momentary anxiety attack, but the sensation didn't pass. It only got worse. Her husband immediately drove her to the emergency room, where doctors discovered that she had a pulmonary embolism, a blood clot that had traveled to her lungs. This condition can be fatal if not treated right away, but Nancy's quick decision to seek help saved her life. Many people mistakenly think that shortness of breath is just a part of aging or something to ignore. But when it strikes suddenly or gets worse over time, it is not something to brush off. In fact, according to the American Lung Association, pulmonary embolism is one of the leading causes of death in older adults, and it often presents with symptoms like sudden shortness of breath, chest pain, and dizziness. And it's not just pulmonary embolism. Congestive heart failure can cause fluid to build up in the lungs, making it hard to breathe, especially when lying down. Some people even wake up gasping for air in the middle of the night. This type of breathing difficulty is more than just a nuisance. It is a warning sign from your body that something is failing. Another deadly cause of sudden shortness of breath is a silent heart attack. Unlike the traditional chest pain that many associate with heart attacks, a silent heart attack often shows up as extreme breathlessness, cold sweats, nausea, and severe fatigue. According to the American Heart Association, 45% of heart attacks are silent, meaning that the symptoms are not immediately obvious and are easily ignored. If you suddenly feel winded for no clear reason, especially if you've been resting or sitting still, it's time to seek medical help immediately. Don't wait to see if it passes. Your lungs, heart, and overall health are on the line. The faster you act, the better your chances of survival. Time is not your friend in these situations. I know it's tempting to wait it out, to hope it will get better on its own, but that's not something you can risk. Whether it's a blood clot, heart failure, or something else, waiting could make a life or death difference. So if you ever find yourself struggling to breathe, if it feels like the air is being taken from you, don't wait. Call for help. Don't assume it's just a passing discomfort. You are not overreacting by getting medical attention. You are protecting your life. Now more than ever, it's crucial to listen to your body's signals. Ignoring these signs, hoping they'll go away, could be the worst decision you make. So take it seriously. Your health is your most precious asset, and every breath you take counts. Don't wait until it's too late. Act swiftly and get the help you need to breathe easy again. Another critical sign that demands immediate attention is drastic and unexplained weight loss. While many people may think losing a few pounds without trying is a good thing, rapid, unintentional weight loss is often a serious warning sign. Imagine waking up one day to realize that your clothes are fitting looser, or you've lost weight without changing your eating habits or exercise routine. At first, you might dismiss it, thinking it's just a natural part of aging. But when the pounds continue to drop off, it could be a signal that something is terribly wrong inside your body. This is exactly what happened to Frank, a 74-year-old man who had always been in decent health. Over a few months, he noticed his pants were sagging, and he had to tighten his belt several notches. He hadn't changed his diet or activity level, so at first he didn't think much of it. But soon, he started feeling weaker and more fatigued, and he noticed his appetite was decreasing. Frank's weight loss wasn't just a minor inconvenience. It was a clue to something much more severe. After a series of tests, Frank was diagnosed with pancreatic cancer, a condition that often leads to rapid, unexplained weight loss as the body's metabolism goes haywire due to the disease. In fact, rapid weight loss is one of the earliest signs of cancer, especially cancers of the pancreas, lungs, and digestive system. The National Cancer Institute estimates that about 80% of people with pancreatic cancer experience unexplained weight loss before a formal diagnosis. But it's not just cancer that can cause this problem. Metabolic disorders, undiagnosed diabetes, and heart failure can also result in drastic weight loss. When the body struggles to absorb nutrients or processes energy inefficiently, it begins to burn through muscle and fat reserves at an alarming rate. This can lead to rapid weight loss, leaving you feeling weaker and frailer as time goes on. Chronic infections and conditions like tuberculosis or autoimmune diseases can also cause the body to lose weight without any obvious reason. In these cases, your immune system is working overtime to fight off an illness, and this drains your energy reserves. If you've lost more than 5% of your body weight in a short period of time, especially without trying, this is a major red flag that should not be ignored. Many people dismiss unexplained weight loss as just a part of getting older, but this kind of weight change is a warning sign that something deeper could be happening within your body. Don't wait until your energy is completely drained or your health has deteriorated further. Acting early could give you the best chance of understanding the underlying cause and getting treatment before it's too late. The sooner you take action, the better are your chances of finding a solution. If you find yourself losing weight rapidly, especially if you're also experiencing other symptoms like fatigue, weakness, or a decreased appetite, it's time to seek medical attention. Ignoring this could allow a serious condition to develop unchecked. Your health is too important to ignore these signs. You may think it's just a phase or something that will resolve on its own, but don't let the weight loss be a silent signal to a far more dangerous disease. Listen to your body and don't hesitate to reach out for help. By recognizing the warning signs early and acting quickly, you can gain control over your health and possibly avoid a much more serious situation down the road. Don't ignore the signs. Your body is trying to tell you something, and it's up to you to take charge before it's too late. Remember, the sooner you act, the better your chances of recovery. Another alarming sign that should never be overlooked is confusion, disorientation, or sudden personality changes. Imagine waking up one day feeling like you're not quite yourself. You can't remember where you put your keys, you're forgetting appointments, or you suddenly find yourself losing track of time and feeling lost in familiar places. It's not just normal aging, it's a red flag. One evening, Lisa, a 66-year-old grandmother, was sitting at home with her daughter when she suddenly seemed distant. She couldn't remember the name of the show they were watching, and she kept asking the same questions repeatedly. At first, her daughter thought it was just a moment of forgetfulness. But the next day, Lisa became confused about the time and place, unable to recognize her own living room. Her family rushed her to the hospital, where doctors confirmed that she had suffered a stroke. Sudden confusion and memory lapses like this are often overlooked as part of getting older, but they could be symptoms of a stroke, a brain infection, or even an advanced neurological condition like Alzheimer's disease. In fact, stroke is the 5th leading cause of death in the U.S., and disorientation or confusion is one of the first signs. According to the American Stroke Association, up to 40% of stroke survivors experience cognitive decline or confusion right after the event. The problem is that many people don't recognize the signs early enough to act, and even though we may brush it off as just aging, it's often a warning from the brain that something is terribly wrong. Infections like pneumonia or urinary tract infections, UTIs, are another major culprit of sudden confusion, especially in older adults. Delirium, a state of sudden confusion, can happen overnight, and it's often linked to infections that affect the brain. It's important to remember that this confusion is not just a temporary lapse. It's a signal that something may be seriously wrong, and waiting too long to address it can make all the difference. Think about John, a 72-year-old man who was recently diagnosed with early-onset Alzheimer's disease. Over the span of just a few months, John's once sharp mind started slipping. He forgot conversations he'd had just hours before, struggled to recognize close family members, and even became agitated over simple tasks he used to do every day. His confusion wasn't just a part of aging, it was an indicator of a devastating condition. Unfortunately, John didn't act quickly enough. By the time he and his family sought treatment, the disease had progressed significantly. Early diagnosis is critical when it comes to cognitive diseases. The quicker you can identify a problem, the better your chances of managing it before it worsens. So if you or someone you love is suddenly experiencing memory loss, confusion, or personality changes, don't assume it's just part of growing older. Get checked out immediately. It might be a stroke, a brain infection, or even an early sign of dementia. But in any case, the earlier it's caught, the better the treatment options. When it comes to brain health, time is truly of the essence. Ignoring these warning signs can lead to permanent damage that could have been prevented. The key is to act quickly. If the confusion persists, if it's out of character for the person, or if it suddenly comes on without warning, don't wait. The sooner you act, the sooner you can get the help and treatment needed to manage the condition. It's never too early to seek help, but it can easily be too late. Don't ignore the warning signs your body is giving you. Take action now to protect your health, and don't wait until it's too late. You deserve to live a life with clarity, peace, and health. And by taking these steps, you can ensure that you're doing everything possible to protect your mind and body. The final sign we must address is severe and persistent abdominal pain. This is a symptom that should never be ignored, and it can indicate something incredibly dangerous. Picture this. You're going about your day feeling fine when suddenly you're hit with a deep, sharp pain in your abdomen. It's not the usual discomfort from something you ate. It's different. The pain doesn't go away. It lingers, intensifies, and makes it hard to even sit up. This is when you should be alarmed. Consider the story of Greg, a 70-year-old man who woke up one morning with what he thought was just indigestion. The pain was sharp and severe, but he dismissed it as a minor issue. It wasn't until hours later, when he couldn't stand the pain any longer, that he called his doctor. He was rushed to the hospital where doctors quickly diagnosed him with a ruptured abdominal aortic aneurysm, a life-threatening condition where the main artery in the abdomen bursts, causing internal bleeding. Greg had no idea that something as simple as stomach pain could be the warning sign of his life hanging in the balance. Unfortunately, he was one of the lucky ones. According to the Centers for Disease Control and Prevention, CDC, aortic aneurysms can lead to death within minutes if they rupture, and many people don't survive the sudden onset of pain. If Greg had waited any longer, he may not be here today. That's why it's so important to recognize when abdominal pain isn't just a harmless ache. It could be a sign of something fatal. The pain caused by a ruptured aneurysm is often described as a deep stabbing sensation in the stomach, lower back, or sides. It's the kind of pain that pulses with each heartbeat, and it doesn't let up. But abdominal pain doesn't always mean an aneurysm. It can also be a sign of intestinal blockage, pancreatitis, or even advanced cancer. All of these conditions are deadly if left untreated. Imagine having intestinal ischemia, where blood flow to your intestines is suddenly cut off. The pain would be intense, your abdomen would become swollen and tender to the touch, and you could feel nauseous or vomit. If left untreated, it can cause the intestines to die, leading to organ failure. Many people who experience this severe abdominal pain think it's just a bad stomach ache, but they are in danger of losing their life. Pancreatitis, another potential cause of severe stomach pain, is an inflammation of the pancreas that can suddenly strike, causing excruciating pain in the upper abdomen that may radiate to the back. This condition often worsens after eating and can lead to organ failure and death if not treated right away. It's not always easy to tell the difference between a stomach ache and a serious condition, but the key is to listen to your body. If the pain is sudden, intense, and doesn't ease up, you need to act fast. Do not wait for it to go away on its own. By then, it could be too late. The fact is, when it comes to abdominal pain, every second counts. If you're feeling severe, persistent pain in your stomach, back, or sides, and it's accompanied by symptoms like nausea, vomiting, or fever, don't hesitate. Get medical help immediately. Delaying could result in the loss of a life that could have been saved with quick action. So, the next time you feel that deep, intense stomach pain, don't brush it off. Don't wait to see if it goes away. This could be your body's final warning, and ignoring it could cost you everything. If you ever feel this kind of pain, call for help right away. Time is not on your side. The sooner you act, the better your chances of survival. Don't let this be the warning you ignored. We've covered some serious warning signs today, and I hope you now understand just how important it is to listen to your body when it sends out distress signals. Whether it's unexplained fatigue, chest pain, shortness of breath, sudden weight loss, confusion, or severe abdominal pain, these are not symptoms to ignore. Your health is your most precious asset, and taking action early can make all the difference between life and death. So please, don't wait until it's too late. If you're experiencing any of these signs, don't hesitate to seek medical attention. By taking control of your health now, you give yourself the best chance for a longer, healthier life. If you found this video helpful, please give it a like, share it with your loved ones, and comment below to let us know your thoughts. Have you or someone you know experienced any of these warning signs? Sharing your story could help others recognize the symptoms and take action before it's too late. And if you haven't subscribed yet, make sure to hit that subscribe button and turn on the notification bell so you never miss out on important health tips and life-saving advice. Your support helps us continue bringing you valuable content to inform, inspire, and empower you. Thank you for watching, and we look forward to seeing you in the next video. Stay safe, stay healthy, and remember, your well-being comes first.